when I was about 9 or 10 years old, my dad had a heart attack, and his cardiologist was extremely thorough and spent a lot of time with me. I actually brought out a model of a heart and said, this is the vessel that was occluded in your dad, and this is why he had the heart attack. And I just got more and more interested in medicine. All throughout high school, I actually shadowed a general surgeon in Canton. I started scrubbing into procedures when I was a sophomore or junior in high school, and scrubbed into a couple dozen procedures during high school, and kind of fell in love with working with my hands and helping people, and kind of never looked back. So I went to medical school at what is now Neomed in Rootstown, Ohio. And then after that, I joined the military and did my residency at Walter Reed Military Medical Center in Bethesda, Maryland. That was a 7-year program. I had some research intermingled with that. It also included cancer training at MD Anderson, my trauma training at Shock Trauma in Maryland, and traveling to multiple other military bases while I completed my training. I had a couple mentors that were ENTs in medical school, and fell in love with the procedures and the breadth of practice. So I treat anywhere from infants to geriatric patients. The breadth of procedures that you do, from something as simple as ear tubes to something as complex as cochlear implantation and neck dissections and robotic surgery. As I explain it to my kids, what I do, I kind of do everything above the shoulders except for eyes and the brain. So I treat hearing loss, chronic ear disease, then especially sinuses, sinus surgery, anything that has to do with the throat, cancer, voice box, hoarseness, basically anything that you're having a problem with above the shoulders and not involving the eyes or the brain is our department. I trained at the top institutions in the nation for their respective fields. MD Anderson is routinely ranked #1 in the nation for cancer surgery. Shock trauma, it doesn't get busier and better than junior trauma training there. And then Walter Reed is a phenomenal collaboration of multiple military hospitals in the National Capital Region, as well as NIH, which we operated at. So I feel like I had, as opposed to a normal residency where you have 5 to 10 attendings who guide you and mentor you, I had over 30 mentors and different surgeons that I worked with throughout my training. I don't think there's anything better in my career field than the first time you turn on a cochlear implant for a patient and they haven't heard anything their entire life, or in an older individual that lost hearing and you turn the hearing back on. And then one of my favorite things is to see my cancer patients at 5 years and kind of say, hey, this is the point where we say you're cured. And that's very, very rewarding.